evening and welcome to another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Scheme to give you information about the scheme, news updates, as well as explain issues around the NHIS. I am your anchor on the program, Hussaina Amina Aboki. Sit back and relax as we unfold the program to you in a moment. First on the program is a highlight of events around the NHIS. In our top story, NHIS assures to capture retirees in the NHIS scheme. And NHIS boss awarded Honorary Fellow of the Chartered Institute of Loans and Risk Management. This and more stories coming your way shortly.
Retirees of the civil service sector will soon get covered by the National Health Insurance Scheme. This was disclosed by the General Manager, Human Resources of the NHIS, Alhaji Sani Garba Affa, who represented the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, at the 2021 NLC Roundtable on Social Protection cover. He was responding to questions by attendees at the event, which held on the 29th of September 2021 at the International Conference Center, Abuja. Mr. Affa stated that plans are almost at the level of implementation to capture the retirees under the scheme.
We have initially started a discussion with the National Pension Commission, but because of the inavailability of the window to fund the arrangement, that was why the arrangement was stalled. Because under health insurance, whatever that one does, there has to be somebody to pay. But where there is nobody to pay, then that's where the issue comes up. So PENCOM has no window of how to fund it, and individual retirees can only fund it through their RSA, but that one has not been fully highlighted and mentioned to them, and for that reason, the arrangement has not been stalled. But thank God for the intervention of the Office of the Head of Civil Service of the Federation, and they have now introduced an issue that is being handled by the Federal Ministry of Health in collaboration with the Head of Service and NHIS, where a retired permanent secretary is chairing the technical committee that are working on the modality for the inclusion of the retirees after their retirement. That is a work in progress, and maybe before the end of the year, we should be able to come up with something that would be made public to the generality of all of us, particularly the retirees and those of us that are on the queue.
Mr. Affa also said that generic drugs are being administered to enrollees of the NHIS and not cheap drugs as claimed by members of the public.
Let me correct an impression. That is what we call branded drugs and generic drugs. Except those that are in the field, you will not understand what it is. But actually, there is no how you can brand any drug as cheap, because it has to undergo a particular process of NAFDAC certification and all the standard organization certification for it to go onto the counter of the pharmaceutical companies for them to be dispensed or sold to the public.
Mr. Affa added that the NHIS is making plans to change that impression.
To address the matter, NHIS has now thought of an idea, if you can recall the PTF days, where drugs of the PTF are being branded and distributed to the facilities that are enjoying the service. NHIS has conceived that idea. We have developed a package on that. We have presented it to the Federal Ministry of Health, which has been adopted and accepted. It is now awaiting presentation to the Federal Executive Council for it to be endorsed and approved for us to be using the NHIS branded drugs across all the facilities that we are going to be using across the country.
In recognition of his strides in stabilizing the National Health Insurance Scheme and taking it to the next level towards attaining universal health coverage, the Executive Secretary of the NHIS, Professor Muhammad Sambu, has been awarded an honorary fellowship by the Chartered Institute of Loans and Risk Management. Speaking during the investiture, Chairman and President of the Council, Dr. Harriet Nkechi Akuwiru, said the award was in recognition of Professor Sambu's leadership and the risks he has taken to get the scheme to where it is today.
There is financial risk, but there are other risks. As insurance people, we want to believe that you also know that endemic to every work you are doing are risks. And what we have come with today is to start up a relationship that will bring you a better understanding of risks, a better management of risks, a better way to mitigate risks, a better way to eradicate risks. But most importantly, a better way to preempt risks so that we can proactively manage them. And we thought after our research that Professor Sambosa has done so much to impact the lives of Nigerians, and we think he is a risk manager par excellence.
Responding, Professor Sambo accredited his achievements so far to the joint efforts and support of his management team and staff of the NHIS.
All this achievement that is purported to have been done is not a one-man gang. It is a teamwork. The team and general managers and the deputy general managers have participated fully in the process of this transformation. And therefore, if I am to be conferred alone, then it will be a selfish endeavor. Therefore, I was very fascinated when the chairman and the president said that we should allow our general managers and other senior members to be conferred with various titles within the institute. Yes. And we have received this offer hook, line, and sinker.
The program is Easy Access to Healthcare for All, bringing you news and issues around the National Health Insurance Scheme. The National Health Insurance Scheme, NHIS, was established under Act 35 of the 1999 Constitution by the Federal Government of Nigeria to improve the health of all Nigerians at an affordable cost. But the agency was not without its own administrative, operational, and industrial challenges. What did the new management under the leadership of Professor Muhammad Nasir Sambo do? Let's find out.
The mandate of the National Health Insurance Scheme is to attain universal health coverage, or UHC, for all Nigerians. This is in accordance with the Sustainable Development Goals (SDGs), to which Nigeria is a signatory. What does UHC mean, and how is the NHIS instrumental to achieving this objective?
Universal coverage, therefore, is a global declaration where every country, everybody should have access to basic healthcare services, irrespective of its age, gender, religious inclination, geographical location, and level of his socio-economic status.
If you look at the definition of UHC, it talks of prepayment. It's one of the key things that the World Health Assembly has prescribed. So when you talk of prepayment, it means you don't go to the hospital with just money in your pocket. You should have paid ahead. That's exactly what NHIS intends to do for Nigeria. So talking of health system strengthening, NHIS is key because NHIS is to mobilize resources for health system. That's a healthcare financing aspect of it. That's exactly what it's intended to do.
Since the establishment of the scheme, there are quite a number of challenges mitigating against the smooth running of the scheme and the eventual attainment of its objectives. One major problem was that the act establishing the NHIS was tailored towards the formal sector employees.
If you look at the law establishing the National Health Insurance Scheme, the law came out in 1999, specifically May. It made provision for the formal sector group. By formal sector, you are talking about employees only, either of the federal government or of the state government or of local government or employees of organized private sector with a number of employees from 10 and above. This is what the law of the National Health Insurance Scheme provided. But we have been working assiduously to ensure that this law is amended, which is part of the presidential mandate that we have been given, that this law should be amended and make it mandatory.
Other challenges that made implementation of the scheme slow, aside the act establishing it, included poor implementation of the scheme's programs, poor awareness and lack of understanding of the scheme's operations, distrust in the scheme by other tiers of government at inception, lack of professionalization of the scheme, and a deficient ICT structure.
When I came back to the NHIS and I saw the level of ICT development, I almost cried, because as far back as 1999, people come to the National Health Insurance Scheme to see computers. People come to NHIS to see effort where ICT can be the in thing. But at the time I came, there was no automation of the business process. In this 21st century, many small agencies have come and they have gone very far in deploying ICT infrastructure. NHIS was far behind.
People need to understand the health insurance itself. It's been a challenge. People talk of 750. That's what we pay for capitation. And then by the time you come to hospital and you have consumed more than 750, people who are not properly educated about this thing will just say that the scheme paid only 750 for you, and now you are coming to consume 5,000 or 10,000. But social health insurance is built on solidarity. And so we continue to educate them that it can't just be 750 out of maybe 5,000 enrollees you have. How many of them are coming to hospital in a month and all that?
Being a scholar of health policy and management, Professor Sambo, when he resumed work as the Executive Secretary, undertook a rigorous assessment of the challenges of the scheme to help in drawing out a plan to develop and rebrand the organization so as to restore its lost glory.
When I aggregate those issues, I now try to go to move into implementation of the first rebranding agenda, which is restoring value system. I invited two professors who have knowledge on organizational development. Then I took all the management, expanded management, into a retreat. And before I took the management into retreat, I circulated a card to every staff of the agency of the health insurance to tell me two problems from his own perspective that he believes that is a problem of NHIS. And he should also give two solutions. So we aggregated this and we went into retreat with the management. We isolated all those problems from the dimension of all the staff. And we were able to put it in a software called Monkey Survey software. And we came with 10 key domains that are very critical, that aggregated all those responses from the entire staff. Because we wanted to ensure that every staff has say in the process of diagnosing the organizational problem and in the process of bringing solution. So through that, we identified 10 key elements of value orientation.
Part of the 10 key elements include the working environment, record system within the NHIS, equity and synergy in the NHIS, rewards and sanctions in the NHIS, amongst others.
We developed a document and we began interaction with the staff in order to understand these key problems. And we try to implement all those recommendations from that 10 key components. And we did not just leave it in a slogan. We walk our talk in terms of this is an organization and nobody is superior over the other. And everything has to be done with clearly adherence to due process.
The implementation of the recommendations gathered brought about a change in the NHIS. For most of the staff, it was a blessing, while for a few, it was not.
We had cause to reward some of the staff. And on the other hand, we saw some people who are leaking sensitive information, and we recommended for their dismissal. For the first time in the National Health Insurance Scheme, a dismissal was institutionalized.
On the other hand, the Executive Secretary embarked on a mission to win the confidence of the stakeholders by going on courtesy visits and a series of engagements to assure them of respect and judicious use of their resources.
Within the first 6 months, we have been able to embark on 6 major stakeholders engagement. We brought our enrollees, who are the kings in the health insurance system. We engaged them. We harness all their problems and all their concerns. We brought in healthcare facilities where there are a lot of challenges. We harness their concerns and we put them on the table. We brought health maintenance organization. We harness all their grievances and we put on the table. We brought donor agencies. We put them on the table. We brought state health insurance agencies. We brought drug manufacturers association. We all interacted with them, and we were able to isolate problems based on their origins and how they can be tackled.
Working with the stakeholders, the new management under the leadership of Professor Sambo began to implement measures that will bring about stability and progress within the NHIS. Evidence of this stability and progress in the NHIS can be seen in the renewed synergy between stakeholders, particularly health maintenance organizations and healthcare providers. These include the employment of 190 health professionals to boost standards and quality assurance of the NHIS, the design, launch and implementation of a new flagship program, GiftShip, to drive the attainment of universal health coverage, the gradual upgrading of processes in the scheme towards the full implementation of NHIS, and resolution of operational issues like drug dispensation under the scheme.
As we speak, we are reviewing. In short, we have reviewed the drug list. What we are doing now, we are working with the International Labour Organization, the ILO, to do the actuarial evaluation of the new list and to be able to determine what the cost will be. So in the next few months, that also will be true with that.
The confidence of stakeholders in the National Health Insurance Scheme has been well and truly restored by the commitment to work with the new management to achieve universal health coverage.
Professor Mohammed Sambo is about the second candidate that will be driving the health insurance scheme the way it was meant to be driven. And I want to commend him for a job well done, and he's still doing it. And we are working closely to ensure that we jointly, lift the scheme up.
Welcome back from that break. Easy access to healthcare for all continues with our stakeholder segment. On today's episode, we had a chat with Barrister Greg Azubuike, the coordinator, NHIS FCT office. Barrister Azubuike shares with us his assessment of healthcare providers and issues of referrals and secondary care.
On the issue of giving authorization codes, they are not always forthcoming in doing that. However, with the way we mediate, we call them once in a while, we bring them together and let them understand that apart from issue of profit, we are all working towards a certain goal to make sure that our citizens access healthcare when they need it. And so that effort is yielding fruits. And then there's something we've been doing also that is quite fantastic, and that is this reconciliation we used to do. We've just concluded, we are still on one right now, whereby we bring the facilities and the HMOs together, because at times the HMOs deny some of the claims that facilities bring. And by the time you sit them down together and discuss with them, you see that actually it's not every claim brought by the hospitals that are really genuine. We've seen instances whereby the facilities themselves admitted errors on their own part as well. So we now do that occasionally, bring these two parties together, sit them down, and trash out gray areas.
On complaints by enrollees about the 90 days waiting period before accessing healthcare under the NHIS, Barrister Azubuike had this to say.
There's what we call adverse selection in health insurance. That is one. You don't wait until you are desperate before you come to enroll. Otherwise, you may crash the system. That is one. Two, we also need time to put our house in order. For instance, you walk in today, we need to register you, we need to do ID card for you, we need to bring all the names together, we need to assign you to your facility, we need to court register, we need to make these things available to the facilities so that when you go there, you're able to access healthcare. These things take time.
Finally, Barrister Azubuike talks about his expectations of enrollees.
Now, what we expect of them is one, they should also be honest. There have been instances, maybe in the past, whereby people clone themselves. You come present yourself as an enrollee, then give the symptoms, maybe your brother or your sister who is to enrolled has, and then you collect drugs and go and give somebody who is not accredited. That is fraudulent. We've had such instances. And then we have instances also whereby people just come just because they feel, well, I paid for this thing, I'm not sick, but I should go and get something. I should just go. Some present in hospitals even when they don't have need to present.
That was Barrister Greg Azubuike, the coordinator, NHIS FCT office. Coming up next, your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: how do NHIS enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital, therefore, in both cases, the hospital will actually get in touch with the health maintenance organization who will actually issue the referral code, and then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. Join us again, same time, same station on another episode as we continue to bring you more stories of happenings around the NHIS. Enjoy the rest of your day.